And if he's not in the right sound mind to make those decisions rationally, then he can be very reckless for our country and for the world.
There are at least now 20 people in the president's orbit who are infected with COVID. That's as many as we know about. There might be more. We still don't know, as you alluded to, we still don't know when he last tested negative, meaning we really don't have an idea of when he first contracted the disease. The only explanation I can think of as to why they keep stonewalling on this very basic question, when did he last test negative, which gives us an idea of when he caught the virus, is that the answer is actually worse than the spectacle of the continued stonewalling. What do you think?
Jake, that's the same behavior we've seen from this president since the start of the outbreak. He has never told us the truth about the risk or the seriousness of this outbreak. He has not told us the truth about his status or when he was infected. You're right. When you hide the truth and you're not transparent, you're hiding something much worse. And by hiding that, by lying to the American public and not telling us the full truth, you're actually prolonging the duration and the impact of this pandemic. You're actually allowing more people to die.
You say it's time for more scientists and more medical professionals, such as yourself, to lay your careers on the line and push back against how the president is handling this pandemic, as you did. Explain more what you mean by that and who you're talking about.
Jake, there are so many career scientists in our government healthcare system, and these are the best scientists in the world. I mean, I would put the expertise and the experience and the judgment of the scientists we have, the CDC and the FDA and the NIH and at BARDA, all throughout our government, up next to or against anyone on the planet, and our scientists are going to shine. They are concerned about this White House and this administration overruling the best scientific judgment. They are concerned about the political pressure that has been put on them to change a course of behavior, a course of action, or to rewrite science, or come up with some fake science and then put it forward as the truth. So they're very frustrated. I hear from my colleagues across our government, in the healthcare system especially, who are very frustrated. They're concerned that the truth isn't getting out. They're concerned that the best guidance and practices aren't being heard. And they're concerned about the lack of leadership, leading by example and encouraging people to follow those guidelines. So their frustration is because by blocking this information, by holding back their best evidence and their best guidance, then it is leading to more infections. It's leading to more hospitalizations. We have 30,000 people in our country right now in the hospital from COVID-19. More people are going to die because scientists are being pushed back. Scientists are not being heard. And I'm trying to speak up and encourage others like me in our medical field, in our scientific field, to speak up, because Americans need to know the truth. The world needs to know the truth. And if we continue to hide the truth, then we're going to see many more deaths that don't need to occur.
What is the truth that you're talking about that they're being prevented from saying?
This is a deadly pandemic. This is a deadly virus. The messaging that President Trump gave to America and the world when he left the hospital about there is no need to be afraid of this virus is probably the most reckless, deadly piece of information I have ever heard. This virus is deadly. It is airborne. And now finally the CDC is being allowed by the White House to tell the world it is airborne. It spreads person to person very easily. Look at the hot spot from that Rose Garden ceremony for the Supreme Court nominee. That one situation, how many people are now infected from that one situation? That's an example for America to see how quickly and easily this virus can spread from person to person. What they're not seeing is the number of people then that they go on to infect, the number of those people that go into the hospital, and then all we're seeing is some tallies, some numbers. And the numbers have a way of hiding the true feelings of life and the emotion, the family, the names of the people that are dying from this virus. The truth is, this is deadly. The truth is, there are things that we can and should be doing to reduce the risk, to slow the spread, to protect our healthcare workers, to protect each other, and to save lives. And the White House refuses to tell people the truth about those measures and their impact.
And you also talk about the politicization of this, the pressure on the scientific agencies to, for instance, when you filed your whistleblower report, it was about earlier this year, you were objecting to the fact that you were being pushed to act as if hydroxychloroquine was a cure-all, was a reasonable therapeutic, when in actuality, at the very least, it is not proven to be that way, and at the very worst, it could actually hurt people.
It's shameful what is happening from the White House, from this president and his senior administration officials, in pushing unproven drugs forward as a panacea, as a miracle cure, as a cure-all, as a gift from God, all the ways that they describe these treatments without any evidence behind them, and pushing them forward, encouraging free, wide access to Americans, in some cases where Americans didn't even need to be diagnosed with COVID-19. Knowing that these drugs could cause significant harm, these drugs could cause death even, it's reckless for the president and his administration to promote these. They're not scientists. They're not medical professionals. They're not healthcare professionals. The scientists know the truth, and their voice has been silenced. That is shameful from this White House.
Stay right there. We're going to come back to you. I want to ask you about the unproven therapeutics that President Trump is now pushing and the possible impact that might have. That's next. Stay with us. This morning, President Trump was celebrating the experimental antibodies he was given at Walter Reed Medical Center on Friday, saying falsely that he thinks he's cured from his coronavirus infection. There is no cure for coronavirus, of course. We asked the ousted vaccine director, Rick Bright, who just resigned from the NIH, about this and why he ultimately decided to leave the Trump administration this week. I want to talk about why you resigned in a second, but first, before you were reassigned to NIH earlier this year, you were involved in developing a coronavirus vaccine as well as therapeutics to help people battling the illness. President Trump is calling the Regeneron antibody cocktail that he took at Walter Reed a cure. He says it's a cure. It's obviously not a cure. He says he wants to give this drug to every American free of charge. Is that possible? Is that wise?
It's too early to know if this drug really works. It's too early to know how safe it is and how effective it is. It's interesting that Regeneron is the first company that I put an agreement in place with in January at BARDA to rapidly start developing monoclonal antibodies for this coronavirus. It's a proven platform. It's worked for Ebola. They were working on it for influenza and for MERS. It made sense to start it with this coronavirus. However, they're just finishing some clinical studies. They put a press release out about a week ago saying they took a quick look and it looks good, it looks encouraging. But we can't allow press releases to drive our science or our clinical judgment. We can't allow a company to promote their own drug and all of a sudden start taking the drug. So it's important that the scientists get all of the data from Regeneron, review that carefully for safety and for its effectiveness, and then make the best judgment on whether or not that drug should be considered for an emergency use authorization. When you talk about making it available for everyone across America, that's very premature. We don't have much data. I think 275 patients were treated so far in the press release. President Trump is one person. He was on more than one drug. Actually, we have no idea what all he was treated with.
They still won't tell us everything that he's on.
So you cannot make a judgment in that way. You cannot rush to judgment prematurely, especially as a world leader, and make some announcement that this is a cure-all. He hasn't seen the data. None of us have seen the data. But it's not the first time he's done this. I mean, he thought hydroxychloroquine and chloroquine were miracles, a gift from God, a cure-all, miraculously going to address this virus. They weren't. He thought disinfectants were something we should look into. That wasn't a sarcastic comment. I watched it. I was horrified that I would get a call within a day at BARDA to start a clinical study or investigating how we could inject disinfectants. That was a real panic moment for us in science. And he prematurely pushed the FDA to give an emergency use authorization to convalescent plasma. We still don't have strong data. The NIH director, Francis Collins, and Dr. Tony Fauci have said the data is still out. We're not convinced that convalescent plasma is working the way they say it is, or they want to believe it is. So this president continues to get a small piece of anecdotal information from either his own personal treatment or from some friends of his.
Like the MyPillow guy who was pushing the oleander extract.
Yeah, that's scary. That is absolutely horrifying, and it does a disjustice to Americans and people around the world who hear him do that, because they're looking to him to be a leader, to be honest, and to guide them through safe and effective treatments through the pandemic. And he has done anything but that by promoting these drugs that aren't supported by science, prematurely pressuring the FDA to put an emergency use authorization in place, and then subsequently potentially causing great harm by making them available for people without the evidence to know who should get it, when they should get it, how much they should get it.
When you hear President Trump say that the vaccine is being delayed because of politics, and that's just politics, my impression is that it's actually the opposite, that it's politics from him pushing the scientists to act quicker than they want to according to protocols to keep us all safe. What is the reality here?
The reality is it's irresponsible and reckless for the President of the United States to drive the evaluation of something as critical as a vaccine to meet an election timeline. He is doing that. He's mentioned it on numerous occasions that he wants the vaccine before the election. There is no rationale and a scientific judgment to move that vaccine to meet that target date. He is not a scientist. He's not a doctor. I say let the scientists do their job. I can guarantee you, Jake, that there are thousands of scientists in our government today, thousands or tens of thousands of scientists in the companies around the world working on these vaccines who are doing the right thing. We need to give them time to do their work. Remember, vaccines go into healthy people to try to protect them from disease. We do not want a vaccine to cause harm in those healthy people, and potentially more harm than they would prevent by preventing infection. So it takes time. Vaccines are very complicated to make. There's a lot of components, a lot of ingredients.
The president says he's just trying to cut through the red tape, that there's just too much bureaucracy. He's trying to push things around to save lives.
That's not true. Not at all. The scientists are working at breakneck speeds. It is unprecedented to see how fast they are moving through a lot of the steps. The one step you cannot rush is the safety evaluation of that vaccine after it's put into people. That takes time.
3 trial.
This phase 3 trial.
Yeah.
Now remember, these people are getting 2 doses of the vaccine about a month apart. And it takes some time after you get that second dose of vaccine to see if anything bad happens. Now we hope that nothing bad happens, but it doesn't always happen immediately. So all the scientists are asking for now, all the experts at the FDA are asking for now, is to give the vaccine time to enable us to see if there are any bad effects that we should be concerned with.
First, do no harm, the Hippocratic Oath.
First, do no harm.
Let me ask you a question. When you filed your whistleblower complaint earlier this year, and then you were reassigned from BARDA to the NIH, there were a lot of critics from the Trump administration of you, alleging that you don't manage your office well, that you mistreat staff, you fail to consult your superiors. I could go on and on. But let me just cut to the chase here. Do you have an axe to grind here? Are you a Democrat that hates Donald Trump because of what he stands for? Why are you speaking out like this?
Jake, I'm a scientist, and I have dedicated my entire life to trying to save people's lives. I've dedicated my career to studying pandemic outbreaks, to focus on development of vaccines and drugs and diagnostics. Response, every facet of responding to a pandemic is what I have dedicated my life career to do. And when this pandemic started, I sprung into action. I found out that I was moving light speed ahead of this administration. Before they were willing to admit we had a problem, I had plans in place to try to make a vaccine. I had plans in place to start drug development. I had plans in place to work on diagnostics and test. We knew what we had to do. But this administration refused to admit it. So I was, I think in their eyes, a fly in the ointment. because I was pushing for the inevitable, this pandemic that was emerging. All the signs were there. I had no doubt in my mind